Action. Donna, are you there?
Yes, I am, Madam Chair.
Okay, why don't you go ahead and take roll just because to make sure that we're clear on propriety, seeing as we'll be taking actions.
Okay. Representative Clifford,
Here.
Representative Connolly.
Here.
Representative Flitner,
Here.
Representative Hallinan,
Here.
Representative Ottman.
Here.
Representative Romero Martinez.
Here.
Representative Stivar,
Present.
Representative Worf,
Here.
Chairman Wilson.
Here.
Madam Chair, we have 9 present.
Very good. All right, good job this morning, guys. I thought that went pretty well. It was actually kind of convenient having people on Zoom, wasn't it? So what my intention is, committee, because we've been here for 10 hours now. And we're not going to work too well if we're here forever. So my intention is whatever bill we're working on at 8 o'clock, we won't stop in mid-sentence, but that will be the last bill. Okay, so, we could work one really slowly. We could work all 4 of them, whatever it is. But that's at 8 o'clock. I'll say, okay, wrap it up and then we go. So we'll do them in order. And as noted, we're not going to take any testimony or anything. House Bill 253 UW ban on funding for abortions. Do I hear a motion on the bill?
Bill.
Moved by Stivar,
Second.
second by Hallinan. Okay. I have received 2 amendments. Does there may be other discussion, but does everyone have 2? Does anyone who doesn't have 2? I guess
I don't have them.
you're supposed to, you had to print them off your computer. Well, I can't help you then. Just follow along. Okay. All
Madam
right.
Chair,
Representative, sorry, Donna, yes?
I've only received 1 amendment, so if somebody has another one they haven't emailed me, that would be appreciated.
Well, they're both from LSO. Are you able to access things from the LSO attorneys?
Okay, I'll look for that. Thank you.
Okay, I'll tell you. So one is PROPHB 0253 H1301. And then the other one is H5701. I'm not going to start until you confirm you have them, just to avoid confusion.
Okay, sorry, I'm going to look.
Okay. Yeah, tell me what numbers you need to find them with.
Madam Chair, I'm going to have you go ahead and proceed. I will just take notes.
Well, they're pretty long. You're not going to want to take notes. Pepper, do you have your oh, yeah, would you? So they're both for House Bill 253. One is Gray, Romero, Martinez, Worf, and the other one is Connolly. Representative Flitner is going to forward them to you.
Thank you.
So, yeah, just Donna Shippen, SHIPPEN, should autofill hopefully. Got it?
No, just so we have them there. Yeah, were they sent to us as well? Because
I got them in my inbox. I didn't really look to see who else is on the thing.
Thank you. I just received the email from Representative Flitner.
Okay, well, hang on. Let me just fire up my computer. Ooh, sorry. Yikes. Sorry about that.
Madam Chair, I do, the amendment that Representative Flitner just sent from Representative Connolly's amendment, I already had. I don't have a second amendment though.
So I'm turning on my computer.
I just sent it. One more.
Madam Chair, I just received the second amendment from Representative Flitner. Thank you.
I don't work fast enough. Okay, well, let's just check all of them while we've got them here. So we don't, okay, here's the ones that I have, committee. For House Bill 253, I have, and I'm looking at the last four digits of the amendment. 5701, Gray Romero Martinez Wharf, 51301, Connolly. Okay, then House Bill 161, I have Amendment 1301, Connolly. One from Wilson that I just typed up myself. It's not on LSO format. Another one from Wilson, same way. So you
No format?
no, I didn't say it had to be formatted. I just said you had to type it. Okay, there we got there. You got, so you got three for House Bill 161. Do you? Yes? No? Guys, I sent them to the whole Labor Committee.
I seen them, but I didn't print them.
Well, do you have your computer?
Yeah, it's upstairs. I'm good.
Then you'll just have to,
I got one right here. I can look through this flexi glass and see Representative Flitner.
just go right. They're my amendments. Okay, folks on the computer down there, are you finding them? Yeah, let's see, I have, I emailed you one at 2:33 PM. It says amendments for tonight. It has 161 and 70 in it. And then I emailed you guys another one at 3:31. Okay. If you do a search, just search on Wilson, let's say, or something like that, and then you can, then that will be easier. Up at the top of your screen.
I'll just write them down.
Which one are we gonna do first?
Well, we're starting with the list.
253.
Yes, 253 is the first one. Okay, let's go ahead and get started. Those of you, let me just confirm on the other ones. So that was, let's see, that was 161. Then we've got House Bill 70. I have one Connolly amendment, one Clifford amendment, and one from me. Donna, are you still following with me? I kind of.
Yes, I am. I have those three amendments on House Bill 70 as well.
In House Bill 134, we have one Connolly amendment.
Correct. That's what I have as well.
Okay, very good. All right, let's begin. Okay. Kind of weird to do it without any testimony, isn't it? Okay, House Bill 253. Let's see, it's been moved and seconded. Let's do the amendments that we have before us, and then we can see if there are others. Seeing as it's only 2 pages long, I don't know that we really have to work it page by page. Okay, the first amendment is the Gray Romero Martinez Wharf one. And And you can see in the catch title, delete University of Wyoming, insert higher education. Line 1, insert and community colleges. So that's, that's the essence of this. Line 8, we've got an insertion of what is presumably the community college statute. And page 2 after line 19. So you've got all the language on the page, or the inserted paragraph starting on line 11 is the University of Wyoming. And then we have the addition of 2118-205 to also insert the same language for community college. Actually, I suppose Representative Worf, since you are on that amendment, I should offer to you you should move the amendment if you want to.
Madam Chair, I'd like to move amendment House Bill 253, amendment number 1.
Okay, any second? Is there a second?
I'll second.
Seconded by Romero Martinez. Oh, actually, you could have done it too. Sorry about that. John,
That's all right. Thank you.
I feel, we haven't really worked bills that significantly yet this year. We had kind of some simple things. Okay, any discussion on that amendment? None, okay. All in favor of the amendment, please say aye.
Aye.
Any opposed?
Opposed.
Okay, that amendment passes. Donna, you got that?
Yes, I did. Thank you, Madam Chair.
Okay, then Kathy, or Representative Connolly, we've got your amendment. You want to make a motion and explain it?
I move a proposed amendment that you have in front of you. And I'll explain it once I get a second.
Okay, moved by Connolly. Is there a second? Second by Clifford. Go ahead, Representative Connolly.
Thank you, Madam Chair. And folks, just in general, I have comparable amendments on all of the bills. And so, with the chair's indulgence, I'll just explain in general what they will all attempt to do. So I think what we all agree on is we want to prevent unintended pregnancies. I mean, that I think is really important. And so many of my amendments have in them the inclusion in some way of having long-term reversible contraceptives available, because that is what we have heard, along with sex education, but that one didn't fit in these bills. But LARCs really do prevent unintended pregnancies, and especially for young women. And so in several places, I have added a requirement that LARCs become available. The other thing that I've been concerned about is money. There's, to me, some unfunded mandates here, both for physicians as well as women carrying pregnancies to term. So any place where we have an unfunded mandate, I have the Department of Health picking up those costs. I'm also concerned about health. And anytime I can, the health of a pregnant woman, and any time that could help facilitate the health of a pregnant woman, I tried to do that as well. So those are the amendments in general. And so what you have with this particular one on the UW ban, it uses, you can see on the amendment page, lines kind of 11 through 17, uses the same kind of language, that's the prohibition in relationship to the health insurance that is available for students. There's two additions. It says that the university will reimburse students for alternative health insurance coverage for anyone who elects to opt out of the only one that's available for students. And then the second is makes available the LARC contraceptives to all students who request such contraception. And so with that, I take any questions or
Questions for Representative Connolly?
ask for your favorable consideration.
So now that my neighbor has taken my amendment, Representative Connolly, I do have a question. So paragraph 2 doesn't say anything about cost. It just says that it should be presumably in the formulary. Was that your intention?
Madam Chair, it simply says that the university should make available, right, obtaining and making available long-acting reversible contraceptives. Now, it is my understanding that from the testimony from the UW physician that they do have some available, but I want to make sure that
Right.
that is available for students, anyone who asks for it.
Okay. Any more discussion on the amendment? No? Okay, all in favor of the amendment, say aye.
Aye.
Opposed?
No.
Okay, that amendment fails. Okay, is there any other amendments for the bill? No? Okay. Question call on the bill. Donna, would you call the roll on 253?
Okay, so this is a roll call vote on House Bill 253. Representative Clifford,
No.
Connolly,
No.
Flitner.
Aye.
Hallinan.
Aye.
Ottman.
Aye.
Was that an aye, Representative Ottman?
Yeah. Aye.
Representative Romero Martinez,
Aye.
Stivar,
Aye.
Wharf,
Aye.
Chairman Wilson.
Aye.
Chairman Wilson, we have 7 ayes and 2 noes. The noes being Representative Clifford and Representative Connolly.
Okay, next bill for our consideration is House Bill 161. And we have 3 amendments. Let's deal with those first, and then if people have other ones, we certainly can do that. The first one that I have in order is Representative Connolly's numbered 1301. Representative Connolly?
You can move the bill.
What?
You can move the bill.
Oh, did we not move the bill?
Move the bill.
Oh, sorry.
I was gonna-
Move, the bill is
I-
moved by Stivar, seconded by Romero Martinez. That's, thank you, Representative Connolly. Too many hours. I want to go home. No, okay, sorry.
All right.
Okay, thank you for that.
So thank you, Madam Chairman. And actually, before I do the one that I had written, I had forgotten one additional 2-worder
Okay.
that I'd like to do as a first
All right,
amendment.
we'll allow that.
So on page 2, after line 20, add in F and add in sexual orientation.
Is there a second? Discussion on the amendment?
Thank you, Madam Chair. And if I may?
Can I ask a question about
Sure.
that? So how is that detected when the child is not born?
Madam,
So that it can be,
um,
to my knowledge.
yeah, so Madam Chairman, this is one of the areas regarding kind of the medical and scientific research on sexual orientation, and it's still up in the air, that's for sure. But some of the most compelling evidence right now indicates that one of the, let me just back up, the medical and scientific kind of question of sexual orientation is answered in part by compelling evidence these days regarding the androgen levels within the womb. So that is a possibility for testing. So it's not on the fetus, but it's about androgen levels.
So that would actually fit in with the potential diet. Well, although I wouldn't, of course, doesn't fit under disability, but
So, Madam Chairman, it's just that is definitely out there.
great. Okay, any other discussion on the amendment? Okay. All in favor of the amendment, say aye.
Aye.
Opposed?
No.
Okay. You can go ahead with the other amendment.
Okay, so thank you, Madam Chairman. So this is an amendment that addresses that health issue that I talked about. And if we have a bill in front of us that is about genetic screening, then this amendment says that the Department of Health shall provide genetic screening without cost for all pregnant women who request it, and that the pregnant women will be informed of the results. And then at the end, it says that the Department of Health shall create and administer a program to reimburse pregnant women who, because of this act, carry to term an unwanted pregnancy. The program shall then cover all medical costs associated with the pregnancy and birth, and costs associated with, but not limited to, healthcare, physical therapy, occupational therapy, special ed, medications in both in-home and out-of-home care for the child until adulthood. This to me is really important. We want healthy kids. And if this bill was to go through, that there is the possibility that women will carry to term an unintended a pregnancy that they would have chosen to terminate. And it's our responsibility to take care of that woman and that child. I can think of no other means of taking care of that pregnant woman and that child through its adulthood. Then we need this amendment.
Questions on the amendment? So I do have a question, which is that because it's on page 3, it's dealing with all of page 2. So, I mean, a person, so, you know, what you put in paragraph E kind of looks like services for a disabled person. But if a person were just doing sex selection, the baby could end up being a perfectly normal female who goes to Harvard, let's just say. Is that what you're intending to categorize under that as well?
Madam Chairman, that's the way that the amendment reads right now, that individuals women are carrying pregnancies that they might not have chosen to. And there's health care that's associated with that we are obligating at this point. You know, much of the discussion that we had earlier today was about children born with disabilities. That was a lot of the discussion, and the amendment really kind of addresses that. If you want a committee of the whole amendment that changes that some, but I think we have a responsibility. If we pass this, then we need to take care of those children and their mothers.
Or encourage them to give baby for adoption. That would be less expensive to the state. But anyway, sorry, kind of razzing you there. Okay. Any more discussion on the amendment? No? Okay. Oh, Representative Romero Martinez.
I just wanted to make a comment that having children is expensive, I think, in every case, and no one can really guarantee a pain-free future for their children. And these never are really excuses for why we should kill them. That's all.
Representative Connolly.
Then Representative Romero Martinez, it would seem to me then that you would agree that we should take care of them. And what this amendment does is assure that care.
we don't have to have back and forth discussion on that. Okay, all in favor of the amendment, please say aye.
Aye.
3 ayes, all opposed?
No.
And 5 nays. Okay, that amendment has failed. You got one there, Representative Connolly. Okay, next, yes.
Madam Chairman, did we vote on the inclusion of sexual orientation because that's not in the
Yeah,
amendment?
no, we did.
And
Yeah.
it failed?
Yeah.
Huh. And I said, huh, all right.
Okay, the next amendments were mine, actually, and so these were in the unformatted. By the way, Donna, are you doing okay?
I am doing okay. Madam Chair, I'm not hearing seconds on these amendments though. So the next amendments we consider, if you can.
I'll be sure to read. Thank you.
Thank you.
Okay. All right. So let me just see, do them in order here. I'm going to actually do I have one amendment that starts on page 3, but that's just a conforming component. So I'm going to start with the one where you had 2 amendments on the same page and it says ADA several lines down. So what this one is, okay, so on page 4, line 14, the definition of disability, I had some concern with that because it says genetically inherited. And if you think about it, there are a lot of disabilities. I mean, congenital means that the baby has it when it's born. It doesn't necessarily mean that it's genetic. So examples of non-genetic congenital disabilities would be, and many of you are too young, but like the thalidomide case where the mothers were given a drug during their pregnancy, or fetal alcohol syndrome, or Zika virus. You remember a few years ago, there was that issue with the mosquitoes. So those are not genetic, but they can nonetheless provide a disability. And I just felt like, personally, so what I did was I looked under the Department of Labor where they have the ADA definitions. So and you guys can vote for this or not. It's kind of it's a policy call. But my amendment would say on line 15, take out the is genetically inherited and instead insert, this is from ADA, could substantially limit one or more major life activity. So disability, it would read, disability means any disease, defect, or disorder that could substantially limit one or more major life activity, including, and then I just left in what was there.
Second.
Seconded by Representative Hallinan. So is there any discussion? I guess I should have had a second before I discussed. I'm slacking off. Representative Clifford?
Yeah. Would you need to delete the is after that? After,
That, oh yeah,
Yes, yeah.
yes, you're right. Thank you. I forgot to write in the word is. So, but the 3 words is genetically inherited. Thank you.
Question, Madam Chair.
Representative Worf.
I just don't know if major life activity, is that something that needs to be defined, or is that defined? You said you got that from somewhere else. Is it defined where you got that?
You know, the ADA is an interesting law in that a lot of things in the ADA are not defined. You remember when we did that bill, was it last week, about prohibiting the organ discrimination? And there was that whole discussion that the ADA doesn't actually have like a list of diseases. It's more a discussion of on an individual basis if this person, you know, can function in certain ways. Now, you know, we may want to pin this down further, and that's okay if you want to, you know, vote no and bring it back. But I just thought we should at least bring this up if we're, because, you know, the person could be in a car accident and then they do an ultrasound afterwards and find out that the baby's legs have been swooshed or something like, I mean, you know, not everything that happens is genetic. I don't remember, I can't remember what percentage of things are genetic. I mean, I think it's only like 20 or 30% or something. And I'm just shooting from the hip on that. But anyway, that's the thought. We can, if it's not tight enough, we can vote it down and bring it back on the floor if we want to. But anyway, so this one I'm starting to take hands just to make sure. Okay, any more discussion on that? Okay, all in favor of the amendment, raise your hand. 1, 2, 3, 4, 5, 6, 7. Any opposed? 1. Okay. So that amendment passes. And Donna, Representative Clifford noticed for me that in my wording on it, it says, I just said delete genetically inherited, but it should say delete is genetically inherited.
Okay, thank you.
And we can keep working on that. Then my second amendment for this bill came in a separate one, although Donna, I sent them all to you in one email.
Yes, I did receive them.
Okay, and so you'll see the first thing says page 3, line 15, delete a new paragraph 12 and insert new paragraphs 12 and 13. And that's just sort of a, you know, the cleanup thing because I'm putting in another paragraph. And this one, again, it's in the definitions. And you remember we had a question this morning from Representative Connolly about what is a lethal fetal anomaly? You know, is that something? So I went online with my friend LSO staff assistant Google, 270,000 hits for, in quotation marks, lethal fetal anomaly. But it did seem to me that it might be, you know, good to actually have a definition. So the one I have before you, I extracted from Indiana statute just because it seemed clean. And it says, so on page 4, line 21, I would insert, if we desire. Oh, do I have a second? Seconded by Worf. God, I'm pathetic. Hallinan, you might have to take over. Okay, as used in this section, lethal fetal anomaly means a fetal condition diagnosed before birth that, if the pregnancy results in a live birth, will with reasonable certainty result in the death of the child not more than 3 months after the child's birth. Okay, now in all things medical, if you've ever had to put a relative in hospice where they say, are they going to die in 6 months? I mean, we know how that goes. Medicine is kind of an art, not an exact science. Neither is this definition exactly, but it's better than no definition. And I think that that's with, as we heard from the physicians, they use medical judgment, and we have medical judgment in statute. So that, just a thought. Any discussion? Representative Romero Martinez.
I didn't intend to omit that definition. Thanks for catching that. That's my only comment.
Well, Representative Connolly.
Yeah, thank you, Madam Chairman. And I too had looked, over the past week for the definitions that I pointed out this morning that I wasn't comfortable with, or words or phrases. Disability, you used the ADA language, so I'm comfortable with that. This one here, I too came up with 1,000 of hits, right? And the definition changes, and it changes regarding wherever you're looking, honestly. And we heard from the physicians that this is such a judgment call. And even the language that you've now suggested is such a judgment call. A reasonable certainty of the death of child in not more than 3 months after the child's birth. So I find it difficult to vote for something that's better than nothing, but still,
Well, that's the whole legislative story.
this doesn't make sense. right?
Let,
To
let me,
this just
how
doesn't
about
make
if I,
sense.
Representative, I beg your pardon for interrupting. Then there were some examples, most of which we won't know. Perhaps Representative Hallinan will, but let me give you a few examples that maybe that'll, and I don't want to put examples in there because that'll be worse, but it says, although rare, a number of fetal anomalies can be detected with ultrasound in which the prognosis is either fetal death or minimal development. Anomalies of this type include anencephaly, so we probably do know what that is. Remember, there's no head. Hydranencephaly, is that the water one? Like water. No brain, but water, right? There's a couple of other kinds that renal agenesis, which I guess would be no development of kidneys. Lethal dwarfing syndrome, and some form, I don't know what the other ones are. Syndromes in which the severe form only are fatal. And so we have some other things that most of which we won't know what the vein of Galen aneurysm, we don't know what they are. Sonogrammic findings of these conditions are reviewed. It was from a medical report. So those are the kind of things that, anyway, we can, as I was, just attempting to help, and we can either like it or not. Any more discussion on Dr. Wilson's attempt to bring in something about which I know minimal? Representative Hallinan.
I like that definition, Madam Chairman.
Oh. Okay, there we go. Not on that basis, let's call for the question. All those in favor of this amendment, please raise your hand. 1, 2, 3, 4, 5, 6. Opposed? 2. Okay. All right, Donna, that amendment passed. Any more amendments on the bill? Okay, question on the bill. Donna, would you call the roll, please?
Okay, this is a roll call bill on House Bill 161, Human Life Equality, Prohibiting Discriminatory Abortions. Representative Clifford.
No.
Representative Connolly.
No.
Flitner.
Aye.
Hallinan.
Aye.
Ottman.
Aye.
Romero Martinez.
Aye.
Stivar.
Aye.
Worf.
Aye.
Chairman Wilson.
Aye.
Madam Chair, we have 7 aye and 2 no.
Okay, so let me just pause here briefly, Donna, just to make sure that we don't have too much cleanup afterwards. So backing up on House Bill 253, we had one amendment that passed.
Yes.
All right. On 161, we have two amendments that passed. I thought I had. Yeah, sorry. I had that.
Yes.
Two amendments that passed. Okay, all right. Okay,
Yes,
next bill for our
right.
consideration is House Bill 70. Do I hear a motion on the bill? Moved by Stivar. Oh, no, moved by Worf, second by Stivar. Moved by Worf, second by Stivar. Okay. Okay, committee, there are three amendments on this. One from Connolly, one from Clifford, and one from me. Okay, so we'll start with the Connolly one. Representative Connolly.
All right, thank you, Madam Chairman. This amendment basically gets rid of the specificity in the bill and addresses, we received an email from 4 physicians over the weekend, and they suggested that there was one sentence in this bill that made sense to them. Other than that, they did not feel that it was something that was enforceable. It wasn't something that they could do, and it was it was unnecessary or meaningless. So accepting what the physicians said, what this does is it deletes the wall of the bill with the exception of adding to on page 4 that the opportunity to view an active ultrasound and hear the heartbeat will be in writing. And then I also add the sentence that any costs that are associated with providing the information shall be paid by the Department of Health. I don't assume that there will be, but that is what the physicians asked of us.
I'm sorry, was there a second? Seconded by Clifford. Okay. Okay, I'm pondering slowly just because I'm wondering whether the cost information needs to be inserted in the bill title, but that can be cleaned up later if necessary. Okay, any discussion on the amendment? No, I don't. It deletes the instructions. Okay. Tell me when you're ready to. I don't want people to vote before they read the bill, the amendment, it seems poor form, right? Okay, Representative Connolly, because some people seem to not have the amendment, just go over again the line on your amendment, the amendment to page 3, because that's the substance of it. And I think people are not really following.
Thank you, Madam Chair. What the bill does is it accepts the recommendation of the group of 4 physicians that wrote to us over the weekend. And they suggested that there is one line in this bill that should be maintained, the rest of it not. So what the amendment does is it deletes all the specificity that you see on line 3 and includes on page 4 the requirement that the opportunity to view an active ultrasound and hear the heartbeat should be done in writing.
Okay.
And that it also says that any costs that are associated with providing that information would be borne by the Department of Health.
So committee, I will just say that if you, I mean, I actually happen to agree with some, and I had some exchange with those doctors as well. As a former healthcare person, and I spent a couple of years doing medical records and working on the floor and all. And we used to say, if it's not written down, it didn't happen. And so I have a later amendment to just take out all the instructions for something to potentially be verbal. I mean, I just don't think in any way you can just say something verbally and then, I mean, suppose a person, and as we heard this morning, I guess I'm off your amendment, sorry. But anyway, there's another amendment coming to this issue. Sorry about that. Okay.
But Madam Chair, this is a great amendment.
All right, no further discussion. All in favor of the amendment, raise your hand.
I had a question.
Oh, I'm sorry, Representative Hallinan.
Thank you, Madam Chairman. Does this amendment require that the Department of Health or pay for the ultrasound or for the ultrasound?
Madam Chair, no.
Representative Connolly,
No, it does not.
Okay, thank you.
just for the Xerox copy, evidently. That would be an interesting invoice. Okay, all in favor of this amendment, please raise your hand. 2, all opposed? 1, 2, 3, 4, 5. Representative Hallinan, you have 6. Okay, 6. Okay, that amendment has failed. Okay, Representative Clifford.
Thank you, Madam Chairman. I move my proposed amendment, and what my amendment does.
I'm trying to be
Yep.
better. I'll be good by the very end of the meeting. Is there a second?
Oh,
Second.
yeah,
Seconded by Connolly. Okay, go ahead.
thank you. So what my amendment does is address, in the bill, it does address the potential risks of an abortion. So what I would like to do is also in regards to the patient's mental health. So my amendment is just acknowledging the potential impacts of a pregnancy risk in regards to a patient's mental health. That's what it's addressing.
And I'm sorry, Representative Flitner. Oh, yeah.
Oh, I'm
Just-
sorry. I'm sorry.
Do people
Sure
have
can.
this?
Actually, I have copies.
Oh, good job.
Oh. Sorry, and I should have
No,
thought
that's
about them.
awesome.
So you did one and better down, yeah. And I'll give you guys a minute. sorry.
Obviously, we'll have to have Representative Clifford be our business manager. Although I printed one out, but that's okay. All right. Are we all got there? Okay, go ahead, Representative Clifford. Start
Okay.
again.
All right. Thank you, Madam Chairman. So what my amendment does is on page 3, line 16, it's going to address the potential impacts of any pregnancy risks on the patient's mental health. And I just thought it was important because it's also going to, in this bill, it addresses the potential impacts of abortion risks. So I just thought any pregnancy risks would need to be assessed as far as a patient's mental health goes. I thought that would be important.
Okay, any discussion?
Madam Chair-
Representative Connolly.
Yeah, Madam Chairman, I think this is a great amendment. If this bill is all about informed consent, then that information I think is crucial to understand the benefits and the risks that are associated with pregnancy as well as abortion. Thanks.
I have a question,
Representative Ottman.
Madam Chairman, and please forgive, but I'm looking down here, page 3, line 18, line 21, and page 4, line 1. When we say delete and insert, I'm not exactly sure what I'm reading to change that to.
Right, so Representative Ottman, what's happening is the text she's inserting where it says page 3 after line 16, and then she's got the insertion of the words. So you see on the bill she's inserting a new number 4 of the new language would become 4.
Oh, I
So then
see.
everything just
Okay,
gets
I
shoved
gotcha.
down the line.
Oh, I see.
Right.
Okay.
So that's
Renumbering.
That's right.
Okay,
Good
thank
question.
you.
Good question.
Thank you.
Is we haven't, nothing like a little practice in reading amendments. And it's hard. I have noticed it really, having to read your amendments, like when we're doing committee of the whole and third reading like we've done, to not be able to mark up a paper amendment, it's kind of a challenge, especially that one of Simpson's that divided 6 ways or whatever it was. Okay, any more discussion on the amendment?
Madam Chairman.
Representative Flitner.
Thank you, Madam Chairman. I don't disagree with with most of this amendment, but I mean, I don't like all of the language. I wouldn't mind having the insertion of just providing information related to the impacts of any pregnancy risk. If it stopped there, I'd probably be in favor of it. But since it speaks to the mental health associated with pregnancy risks, I'm a no.
Well, you could maybe there would be a friendly amendment that, but that's up to Representative Clifford. She might not consider it friendly. Do you have an amendment?
Madam Chairman, I may propose a friendly amendment if Representative Clifford
Representative
would
Clifford
be.
can decide if it's friendly or not. Okay, go ahead,
Right.
Representative Flitner.
I would propose that after the word pregnancy, you delete risks on the patient's mental health. And so it would just say the potential impacts of any pregnancy to be provided in writing.
So weight gain, nausea, low bank,
Worry,
late night.
stress,
Right.
worry,
Stress.
sleeplessness.
Right, okay. Representative Connolly, did you consider that a friendly amendment or not?
Clifford.
I mean, sorry, beg your pardon, Representative Clifford. So it's
I'm on
different,
the
you're right. It's
spot,
not exactly
but
the
I
same.
gotta like process this because I just so echoed what this bill does, and the intent of this bill again goes back to it's addressing abortion, it's informed consent. And so I just mirrored the other requirement. If you'll look on page 3, line 18, so you're gonna do the same for an abortion on the patient's mental health.
Mhm,
So I just mirrored that,
right.
you know, so I don't know if I consider it friendly or not.
So you can say no. I mean, the thing is,
Yeah.
we've got readings ahead. I mean, you know, further amendment might come on the floor. If you say no, then we'll just vote on yours as it is.
Yeah,
Right.
so in relation to this bill, yeah, I just have a hard time because I think it will affect a patient's mental health in relation to this
Okay,
bill.
so we'll
Yep.
take the amendment as it is. All in favor of any more discussion on the Representative Romero Martinez?
I don't know that I can make, I'm a visual learner, so I'm trying to visualize everything. I just wanted to say I agree also that there are potential impacts of any pregnancy. I don't have a solution right now. I just wanted to say that
Well,
maybe on the floor, if I can
then I would
process
say
something.
several folks can get together and work themselves a committee of the whole or second reading or something or other like that if you have them. But better to, you know, it's kind of a pain to do standing committee amendments and then have to tidy them up later. So I would, okay, sorry. So all in favor of Representative Clifford's amendment, please raise your hand. 2, opposed? 1, 2, 3, 4, 5, 6. Okay, that amendment fails. Okay, then, oops, I have 2 copies. All right, then my amendment is, and so you received, this is on the bottom of that one that was had the ADA language. It says Wilson Amendment for HB 70. And again, this is just as I say, and I sort of drifted there a little bit before. You know, when I was working as a unit clerk before I went back to grad school, they used to say, you know, if you didn't write it down, you didn't do it. And so that's just, and frankly, I think that this clears it up entirely. We had some discussion, I think it was this morning with one of the doctors, but you know, suppose a person were unhappy with I guess it was with Dr. Bartholomew. You know, if you removed some part of their lung and then the person said, well, I didn't know it was going to make me not be able to breathe good. And they came back, you know, this having everything in writing provides, you know, legal defense to the physician, which frankly is really what, I mean, it's certainly about educating the patient, but the point of having it in writing is that it's proves that the physician did it. And personally, I can visualize this really. We've all, when we go to the doctor, you know, how many times do you have to they give you this HIPAA form now, right? Ever since HIPAA, you know, you got to sign this little HIPAA form. And if you have a procedure, they give you, I mean, so I'm just visualizing that the provider's office, and this speaks to Representative Connolly's concern about the health department. I mean, in the amendment that failed paying for it, you know, once they do up a 1-page thing, and I did ask that doctor, and I don't remember her name, I have not received anything from her, but remember this morning she said that they had a standard form and I asked if she would send it, which I haven't gotten it yet. But so on line 3, no, sorry, page 3, line 7, I delete the word verbally and put in writing. So it would just say to be provided in writing. On page 3, line 22, I delete verbally or in. So it would just say or no, I'm sorry, verbally or,
Yes.
to be provided in writing. Donna, did you hear my correction there?
Yes, I did, Madam Chair.
And then on page 4, line 4, delete verbally and insert in writing. I mean, I think that just cleans it up from a
I'll
medical
second it.
records point, seconded by Flitner. Oh, I guess I keep explaining it before I get the second. Sheesh. Okay, any discussion of my amendment?
Question.
No questions, okay. All those in favor of the amendment, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8. Opposed? All right, so that amendment passes. Okay, any more amendments on the bill?
Madam Chairman,
Representative Flitner.
I do have an amendment.
Oh, very good.
On page 3,
Okay,
line 21,
okay,
after the word governmental, insert or nonprofit. So it would read information on governmental or nonprofit services for pregnant women and so on and so forth, to be provided in writing.
okay. Is there a second on the
Second.
amendment?
Second.
Seconded by Romero Martinez. Any discussion?
Question.
I was just gonna say, and so presumably this is up to the provider to what they specific, there's specifics and if it's local or across the county or whatever, I think that's good that it's open. Okay, all in favor of the amendment, please raise your hand. 1, 2, 3, 4, 5, 6, 7 opposed. 1. Okay, that amendment passes. Donna, did you get all that need on that one?
Yes, I did. Thank you.
Okay, any other amendments? Okay, question on the bill. Donna, would you call the roll, please?
All right, this is a roll call bill on, a roll call, I'm sorry, vote on House Bill 70, abortion informed consent. Representative Clifford,
No.
Connolly.
No.
Flitner,
Aye.
Hallinan.
Aye.
Ottman,
Aye.
Romero Martinez,
Aye.
Stivar,
Aye.
Wharf,
Aye.
Chairman Wilson.
Aye.
Madam Chair, we have 7 aye and 2 no, the noes being Representative Clifford and Representative Connolly.
Okay, so just to make sure on that one, we have one amendment.
Madam Chair, I
Two
have the
amendments. You're
two
right.
amendments
Two
passed.
amendments, good.
Okay.
Very good. Okay, next bill. Last bill. Good job, guys. We're doing very speedily. Okay. Last bill for consideration is House Bill 134. Do I hear a motion on the bill? Moved by Stivar, seconded by Ottman. Okay, and we do have one amendment. And this is by Connolly. Okay, Representative Connolly.
Thank you, Madam Chair. What this amendment does is say that using fetal heartbeat as a determination is not best practices. It's not used practices. We heard this morning from physicians that they're concerned about there would be a life-threatening lack of care by some pregnant women by this new arbitrary definition. We already have in statute viability. That is language that they are used to, that they use, and that this new language, which is something that could happen for some at 6 weeks, for others, it sounded like double, if not longer, that it didn't make sense. And so what this amendment does is require that the State Department of Health do an extensive study, including kind of discussion with physicians about the proper definitions that we should be using.
Okay, Representative Connolly, I'm trying to track this in. If I can just make a friendly, I think on page 1, line 1, we want to also delete providing, right? Because the page 1, line 4, inserting requiring a report. I think that word providing ends up being extraneous here. I
Could
have to-
be.
Here.
I'm gonna believe you.
So
Yep,
it says
I see two
that
providings.
no, so we want to delete to here, right?
Mhm.
Okay, all right. So let me just, that was a, I guess I have to move that as a friendly amendment?
That's a
Or
friendly
is that okay
amendment.
with the second? Who was the second? I don't remember, or no, wait, who's? Ottman seconded. Was it you that seconded Representative Connolly's amendment?
No, I seconded.
Did we?
It was the previous one.
I
You moved it, right? Or-
think you moved it. Who's?
I seconded to begin, but I haven't.
No, okay, well, somebody second Representative Connolly's amendment. Go ahead, Ottman. So you can second it. Okay, seconded by Ottman. Okay, so is my friendly amendment okay with the second?
Yes. Oops, sorry, wasn't me.
Madam Chair, would you please repeat it, your amendment?
The friendly amendment is that in the amendment on line 1 of the amendment where it says delete that no, it actually needs to say delete providing that no. Do you have the amendment?
No, no, it's here.
Okay.
Page 1, line 13. That's the first part that I have.
All it's doing is getting rid of this
Oh, here we
providing,
go,
but it's
here we
just
go.
grammar.
Okay.
It's just a cleanup.
Yes.
Okay, all right. We don't have to, do we have to vote on the friendly amendment? No, okay, all right, okay, all right, sorry, now I'm still reading you the rest in. Let me look at. Okay, we can read in, let's see, so delete an act relating to public health and then insert requiring a report. And providing for an effective date. Okay, so then we delete the entire bill. So the bill turns into a study bill.
Correct.
May I see that?
October 1, 2022. That's pretty long out. But we can amend that later. Well, let's deal with this one first, and if we want to change it, we can. All right, so committee, this then deletes the actual effect of the act and turns it into a study bill of the issue of fetal viability with a report to us in a year and a half. Which would be something I think that I might gotta be able to do it faster than that. We'll all be dead and gone by that time. Okay, any more discussion about the amendment? Representative Hallinan.
Madam Chairman, thank you. I don't think this is a necessary amendment because if you hear the heartbeat, then you know that there is definitely a heart beating there. If you don't hear it, and I would say that ordinarily you can hear it by the 8th week of pregnancy. In my experience, if I don't hear it after 8 weeks, I'm concerned that there might be a miscarriage. So I really think that this amendment is unnecessary because by the fact that there is a heartbeat, that means that there is a heart, and that is a life. And that's the whole issue that this bill is about. So with that, I would speak against this amendment, Madam Chairman.
Okay, any more discussion on the amendment?
Madam Chairman?
Representative
Yeah,
Connolly.
Madam Chairman, what this does is really take on the question of viability and an alternative definition. That's a real big deal. Let's face that. There's very few places that do that. This bill in it has a repealer, and it repeals the section of our statutes that defines viability. I think it deserves rigorous study before we move in that direction.
Okay, any other discussion? Okay, all in favor of the amendment, raise your hand. 1, 2, 2. Any opposed? 1, 2, 3, 4, 5, 6. Okay, that amendment fails. Okay, that's the only amendment that we have in writing. Is there any other discussion on the bill? Question being called. Donna, would you call the roll, please?
Okay, this is a roll call bill on, or a roll call vote on House Bill 134, Human Heartbeat Protection Act. Representative Clifford,
No.
Connolly,
No.
Flitner,
Aye.
Hallinan,
Aye.
Ottman,
Aye.
Romero Martinez,
Aye.
Stivar,
Aye.
Worf,
Aye.
Chairman Wilson.
Aye.
Madam Chair, we have 7 aye and 2 no votes, the noes being Representative Clifford and Connolly.
Okay. All right, committee, that is all. We did good work. We did really fast. We will have, I have a list of Senate files, but I haven't decided what to hear yet on Friday. Let me just, while we're here. Oh, that's here behind me. Okay, the Senate files that I have, just for your information. Senate File 30 is the Pandemic Response Review Task Force, brought out by Senate corporations. First, I'm just going to tell you my opinions. You can obviously have your own opinions. I think that that's a good bill. I think we've all seen through the pandemic that a little, after action review, which you do every time, in any kind of law enforcement, security, military incident, whatever. I mean, it's a good thing to kind of review what happened. So that'll be interesting. Senator Case has Senate File 47, which is clinical laboratory regulation. I haven't looked at it yet. I'm not sure what is involved there. Senate File 52 is actually a Labor Committee bill. It's just been very slow and percolating over here. That was when, if you listened in on the interim, that's the mental health insurance parity that we did from the interim. Just a real one-liner. Should be, frankly, I shouldn't be too much trouble. And then 2 others that are licensing types that I haven't looked at, Senator Cooper's Senate File 109, Board of Dental Examiners amendments. I have been assured by all parties involved that this is not a wild knockdown, drag out dental fight, that this is just a cleanup bill of something or other. Ojalá. And then Senator Pappas has speech and hearing specialist licensing amendments. And I know it was, I can't remember, Representative Stivar, Representative Helen, was it last year or 2 years ago? Remember we had the speech and hearing bill. I remember being in the Capitol for it, but I can't really remember when it was. Was it just last year? Doesn't last year seem like about 10 years ago? Anyway, I think there were some tweaks in that. I mean, I know there were some difficulties like with the fingerprint requirement or something like that. I expect that one is probably just a cleanup bill. So now that we've developed, we've learned to pick up the pace a little bit more, I think we might actually attempt 2 bills Friday morning. Some committees do like 4 or so, but we're all inquiring minds want to know, and that's good. Keeping in mind also, just a reminder before we go, and we're doing so good, remember my discussion that I'm going to ask Management Council to give us a 7th day during the interim that I visualize of being a Zoom education meeting. I'm kind of visualizing like 4 2-hour training experiences for us. The things that have come to my mind are to understand Medicaid just in general, how it works. Maybe one on hospital cost structure, kind of because we've got, we did table Representative Stitt's bill, but just the whole issue of healthcare costs is really significant. It seemed like I had another one. I can't remember what it was, but anyway, just, as things come across your desk or you read things or you just wonder, well, what was that all about? Just keep yourself a little note on what those are. I don't think I think like 4 2-hour ones will probably be good, but I just feel like the big issues that we can delve into, if we can have some education up front, there's still going to be weighty things that I think we'll tackle during the interim. I mean, we may be doing some broad look at pharmacy or dentistry, workers' compensation, I think might be on the list, and those will require education as it is, but probably not a 2-hour thing. But so I'm looking at, what do you feel like, wow, and I've actually had a couple people, new legislators just up on the floor. One of them was sent to me by another legislator who told him, if you want to know about Medicaid, and so I think these will be ones that I will, it doesn't even have to be just for our committee. I mean, a lot of these issues like Medicaid or healthcare costs, there are other people than us that would like to know about those issues. And so it'll be something that we'll invite other people to observe and learn if they want to as well. So just for you to kind of put in your mind what with Representative Speaker Barlow's announced reminder that we're halfway done with this session. Okay, very good. Good job. Good work, folks. The meeting is adjourned and I'll see you all 10 o'clock in